Welcome to the Deep Dive, where we take those intriguing case reports that have you scratching your head and dissect them to extract those clinical pearls. Today we're diving into a fascinating case from the Journal of Veterinary Internal Medicine about a German Shepherd with an incredibly rare spinal cord tumor.
Yeah, it's a case that really challenges our understanding of these tumors and highlights the importance of those subtle diagnostic clues we sometimes encounter.
Okay, so picture this. You've got an 8-year-old German Shepherd in your exam room, and the owner is concerned because their dog has been dragging its right front leg for about a week. What are the initial red flags that pop into your mind?
Well, first off, the breed itself raises a red flag. German Shepherds are predisposed to certain types of cancers, including hemangiosarcoma, so that's always in the back of your mind. Then, when you factor in the clinical signs, the weakness, and potentially some pain, especially with neck movement, it starts to paint a picture of a possible spinal cord issue.
And sure enough, the MRI results in this case revealed a mass in the cervical spinal cord. But here's where things get really interesting. The report describes the mass as T2 hypointense, T1 isointense, and strongly heterogeneously contrast enhancing. Now, I know we're all vets here, but could you break down those MRI terms for us? What do they actually tell us about what's going on in the spinal cord?
Absolutely. Those terms are describing how the mass appears on different MRI sequences, which gives us clues about its composition. When something is T2 hypointense, it often means there's something dense there, possibly blood products, which would indicate hemorrhage. And the fact that it was strongly contrast enhancing suggests a tumor with a lot of blood vessels, which, as we'll see, fits with the eventual diagnosis.
And that diagnosis, as you alluded to, turned out to be hemangiosarcoma.
Right.
Now, for anyone who might not deal with these tumors every day, what makes hemangiosarcoma so challenging?
Hemangiosarcoma is a particularly aggressive type of cancer, and what made this case especially unusual is that the hemangiosarcoma seemed to have originated from a pre-existing benign tumor called a hemangioma, and this occurred within the spinal cord itself. This primary origin in the central nervous system is incredibly rare for hemangiosarcomas. We typically see them originating in places like the spleen or the heart, and then potentially spreading to the brain or spinal cord.
So it's like this tumor had a bit of an identity crisis, starting out benign and then taking a turn for the worse. Unfortunately, the dog in this case had a rapid decline. Just 24 hours after the MRI, her condition had worsened drastically, and the owners made the heartbreaking decision to euthanize. This rapid decline is something we often see with aggressive tumors like this isn't it.
It is, and it really emphasizes the importance of early detection and having a broad differential list, even considering those rare possibilities. You need to be prepared for anything.
Absolutely. Speaking of differentials, when you saw those MRI findings, what else was on your radar? Were there any other potential diagnoses that could have presented similarly?
That's a great question, and it's where things can get tricky. While those MRI findings were suggestive of a vascular tumor, we can't rule out other possibilities based on imaging alone. For example, other types of bleeding tumors, even something like a hematoma, could potentially look similar on an MRI. And depending on the clinical presentation, we'd also need to consider things like an atypical intervertebral disc extrusion or even inflammatory conditions like meningomyelitis.
So we need to be thinking about those zebras even if we're practicing in a paddock full of horses.
Exactly. And that's why a comprehensive approach is so crucial. You need to take into account the history, the breed predispositions, the clinical signs, and of course, those diagnostic imaging findings. It's all about putting the puzzle pieces together.
And speaking of puzzle pieces, let's talk about those MRI findings in a bit more detail. We touched on those T2 hypointense areas and the strong heterogeneous contrast enhancement, but the report also mentioned something called internal susceptibility artifact on the T2 weighted images. What's the significance of that finding, and how does it relate to those other MRI characteristics we discussed?
You're right. That's another important clue. That internal susceptibility artifact on T2 weighted images is essentially a fancy way of saying that the MRI signal is being disrupted in a specific way that's often associated with hemorrhage. It's like a little beacon flashing blood products here. This finding, coupled with that strong heterogeneous contrast enhancement we talked about earlier, which suggests a lot of blood vessels, really starts to point us in the direction of a highly vascular tumor like hemangiosarcoma.
So we've got those two big clues pointing towards a very vascular tumor, the contrast enhancement and the susceptibility artifact. If you were to explain this in a way that clicks for everyone, how would you connect those findings to what's actually happening within the tumor itself?
Imagine a bustling city with a chaotic traffic system. The contrast enhancement is like highlighting all the roads and highways within that city, in this case, the tumor's blood vessels. The more enhancement we see, the more roads there are and the more vascular that tumor is. Now imagine those roads are all jammed up with traffic at a standstill. That's kind of what's happening with the susceptibility artifact. It's like the MRI signal is getting stuck in all that traffic congestion caused by blood breakdown products in those abnormal leaky blood vessels.
That's a fantastic analogy.
Yeah.
It makes those complex MRI findings much easier to visualize. I know we're getting deep into the weeds here, but there's one more MRI detail I want to unpack before we move on. The report mentions that the spinal cord itself, not just the tumor, showed signs of marked T2 hyperintensity surrounding the mass. What does that tell us, and why is it significant?
That's a crucial detail because it speaks to the tumor's impact on the surrounding environment. That T2 hyperintensity indicates edema, meaning there's a buildup of fluid within the spinal cord. Remember, the spinal cord is a very confined space, so any swelling or inflammation can put pressure on those delicate nerve fibers.
It's like trying to stuff a week's worth of clothes into an overnight bag. Something's got to give.
Exactly. And in this case, that pressure from the edema likely contributed to the rapid neurological decline we saw in this poor dog.
This case is already proving to be a goldmine of information. We've talked about the initial presentation, the MRI findings, and the eventual diagnosis of a primary spinal cord hemangiosarcoma. But what makes this case even more intriguing is the fact that the tumor itself had two distinct parts, almost like it couldn't decide whether it wanted to be benign or malignant.
You're right. This tumor was a bit of a Jekyll and Hyde character, and it's one of the reasons this case is so fascinating.
Well, I'm dying to hear more about this tumor's split personality. But before we get ahead of ourselves, let's take a quick break. When we come back, we'll delve into the histological findings that revealed this tumor's dual nature and what it means for our understanding of these cancers. Welcome back to the Deep Dive. Before the break, we were getting ready to unravel the mystery of this German Shepherd's tumor and its intriguing dual nature.
Yes, this is where the pathology report really starts to read like a veterinary detective novel. Remember how we talked about those MRI findings suggesting both benign and malignant features? Well, the histopathology confirmed that suspicion.
So walk us through, what did the pathologist actually see under the microscope?
Imagine looking at a city map, but instead of streets and buildings, you see different cell types. On the outskirts of this tumor city, things were relatively organized. The report describes variably sized vascular channels lined by bland endothelial cells. This area resembled a typical hemangioma, benign and relatively well-behaved.
Okay, so the suburbs of Tumorville were pretty calm and collected. What happened as we moved closer to the city center?
That's where things took a turn for the worse. Instead of those orderly streets and well-defined structures, we see chaotic clusters of atypical neoplastic polygonal to spindled endothelial cells with a significant amount of cell death. These are the hallmarks of malignancy, screaming hemangiosarcoma.
So it's like this tumor had a split personality, a Dr. Jekyll and Mr. Hyde situation happening right there in the spinal cord.
Precisely. And the million-dollar question is why? What causes this type of transformation from benign to malignant? Unfortunately, the exact mechanisms are still a mystery, but researchers are exploring potential genetic and environmental triggers for this kind of transformation. It really opens up a whole new avenue for understanding these tumors.
It's incredible to think that something seemingly straightforward like a hemangioma could harbor such hidden complexity. This case really throws a wrench into our understanding of how these tumors behave. But let's bring it back to a practical level for a moment. If we encounter a case like this in practice with a tumor exhibiting both benign and malignant features, what are the implications for treatment and prognosis?
That's the million-dollar question, and unfortunately, there's no easy answer. These cases are often managed on an individual basis, taking into account the tumor's location, the extent of malignancy, and the overall health of the patient. In some cases, surgery might be an option, while in others, radiation or chemotherapy might be considered. However, the presence of both benign and malignant features within the same tumor adds another layer of complexity, and it's an area where we need more research to guide our treatment decisions.
It sounds like we're venturing into uncharted territory with these types of tumors. It really highlights the importance of staying informed about the latest research and being willing to adapt our approach as we learn more. Now, before we get too lost in the weeds of treatment protocols, I want to circle back to something you mentioned earlier, the importance of early detection. For those of us who might not be neurology specialists, what are some of the key red flags that should make us think spinal cord tumor, even if the presentation isn't entirely clear-cut?
That's a great question, and it's something I emphasize to all my veterinary colleagues. Early detection is crucial, especially with these aggressive tumors. Keep a close eye out for any changes in gait, particularly weakness or dragging of the limbs, especially if it's specific to one side. Neck pain or stiffness, difficulty jumping, and urinary or fecal incontinence are other warning signs.
So those are all things we should be paying close attention to during our neurological exams. But what about breed predispositions? We know this case involved a German Shepherd, a breed sadly overrepresented when it comes to certain cancers.
Yeah.
Should we be extra vigilant in those breeds known to be at higher risk for tumors like hemangiosarcoma?
Absolutely. While any breed can develop these tumors, certain breeds like German Shepherds, Golden Retrievers, and Labrador Retrievers are more predisposed. If you see one of those breeds with any of the clinical signs we just discussed, it's essential to have a high index of suspicion and consider advanced imaging like an MRI sooner rather than later.
It sounds like a trust your gut situation, especially when those predispositions align with those subtle clinical signs. Now, I want to shift gears for a moment and talk about those differential diagnoses we touched on earlier.
Absolutely. It's like being a detective. You have to consider all the suspects before zeroing in on the culprit.
So let's play a little game of what if. What if this German Shepherd hadn't developed a primary spinal cord hemangiosarcoma? What other possible diagnoses might have been on the table, given her clinical signs and those MRI findings?
Well, right off the bat, that T2 hypointensity on the MRI, especially with this susceptibility artifact, screams hemorrhage. So we'd have to consider things like a spinal cord hematoma, maybe even an atypical intervertebral disc extrusion with bleeding into the spinal cord.
Okay, so trauma or a slip disc could be potential culprits. What about those inflammatory conditions we talked about earlier? Could they cause similar MRI findings?
They absolutely can. Meningomyelitis, which is inflammation of the membranes surrounding the brain and spinal cord, can definitely mimic some of the imaging characteristics of a tumor, especially in its early stages. We might also see those T2 hyperintensities with edema.
So how do we differentiate between these inflammatory conditions and a tumor like a hemangiosarcoma?
That's where the real detective work comes in. A good history is crucial. Was there any recent illness, vaccinations, anything that could point to an inflammatory response?
Makes sense. And what about the neurological exam? Would we expect to see any differences in the dog's presentation depending on the underlying cause?
Absolutely. With inflammatory conditions, we often see a more symmetrical presentation of neurological deficits, whereas tumors tend to cause more focal or one-sided signs, as we saw with the German Shepherd's right-sided weakness.
So it's about connecting the dots between the history, the clinical signs, and those MRI findings. No single piece of information can tell the whole story.
Exactly. And sometimes, even with all the pieces in front of us, the picture remains blurry. That's the nature of veterinary medicine. It's full of unknowns and unexpected twists and turns.
It sounds like we really need to be masters of observation and deduction in this field. Now, I want to circle back to one final point before we wrap things up. We've been dissecting this case from every angle, but ultimately this German Shepherd story ended in euthanasia, highlighting the often devastating nature of these aggressive tumors. What key takeaways do you hope our listeners, especially those who might be early in their careers, take away from this case?
That's a really important question. This case, while heartbreaking, is a powerful reminder that we're always learning in veterinary medicine. We need to be humble, we need to be curious, and we need to be prepared for the unexpected.
Those are certainly words to practice by. It's about constantly challenging our assumptions and remembering that every case, even those that don't have a happy ending, has something to teach us.
Absolutely. And I think this case also highlights the importance of clear and open communication with pet owners. These are difficult conversations to have, but we owe it to our patients and their families to be upfront about the challenges and to approach these cases with both compassion and clarity.
Couldn't agree more. This German Shepherd story, while ultimately tragic, underscores the profound bond between humans and animals and the privilege we have as veterinary professionals to care for these amazing creatures. And sometimes that care involves helping families navigate incredibly difficult decisions with empathy and understanding.
Well said. It's a responsibility we don't take lightly.
Absolutely. This has been an incredible deep dive full of twists, turns, and valuable insights. So for all of you listening, remember that even in the face of challenging cases, there's always something to learn. Keep those minds sharp, those diagnostic skills honed. And remember, from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.